Hi, this is Dr. Fab Mancini, and I'm so excited that you have joined us for this amazing call, primarily because we wanted to be able to bring about a subject that is so important right now, and that is the subject of progesterone. You know, as a healthcare provider for over 30 years, I realized that so many questions when I do my television segments or my radio shows, or even my public speaking, that so many questions are geared towards this hormone called progesterone. But what I'm finding is a lot of times we just don't understand it. And the important thing about not understanding something is that sometimes we don't get to make the right choices, and we feel that our body is changing, and all of a sudden we have symptoms that we just don't understand where it comes from. And many times the funny thing is that you see those symptoms on other people around you, and you begin to think that it's normal. But let me tell you, it is not normal not to feel well. Our bodies are designed to be healthy. Our bodies are designed to age and live a long time in a healthy way, not that after you start turning 40 and 50, like most people say, everything starts changing and it's on the way downhill from there. So I have two amazing individuals that I'm bringing to you that are the experts on progesterone around the world. And I wanted to identify from them what is it that they learn over the years? What is it that they learn with thousands and thousands of people about this thing we call progesterone? So Michael and Emily Graves, thank you so much for joining us.
You're welcome, Dr. Fab. Thank you for inviting us.
Yes.
Well, Michael, let's start with you. You've been in this journey for, I believe, over 25 years. You're one of the world leader of understanding progesterone and being able to help so many people out there regarding this one hormone. But what is it that you feel that people need to know as to what is progesterone? And are there only one type of progesterones that we should be aware of?
That's an excellent question, because sometimes people have a fear when they hear about a hormone, in particular progesterone. And the reason they have a fear is there are two progesterones, Dr. Fab. One that's made by the body, that is the master hormone in all women. And if a woman does not make enough of her master hormone, she has a lot of health challenges. The other progesterone is the one that's synthesized. It's the pharmaceutical compound. It's and all progesterones. Progesterone is a hormone that could be supplemented, and they have a fear factor. It's only because they are not clear on the two progesterones. The one that's made by pharmaceutical companies that has issues, but the one that's safe and natural, made by the female body, that when it's used correctly over the 25 years that we've worked with it, we have not observed any side effects with a topically applied natural progesterone.
So Emily, as a woman, tell me a little bit about your understanding of progesterone. And let's say that I'm watching this video, or I'm listening to this call, and I'm trying to myself understand a little bit about this hormone that I have inside my body. Tell me a little bit about what is it that I need to know about this, and what is it that happens when your progesterone may not be at the proper levels.
So one of the few things that on my journey with all of this that I've understood is that most women have no idea what progesterone is. For some reason, we label testosterone as men and estrogen as females. And the body makes 27 different estrogens, but it's only the hormone that you need for half of the month. The other half of the month you make, as Michael just said, the one progesterone. And one of the most fascinating things I think I found in my journey is that we're living in an environment and a time frame where we're exposed to a lot of environmental chemicals, and there are over 100,000 chemicals in use alone in our cosmetics, and those chemicals are synthetic and they're acting like estrogens. There's nothing in the synthetic environment that we're in that acts like progesterone. Nothing. So all of these, unless it's synthetic progesterone, of course, but there's nothing in that we're plugging into or putting on our body that's acting like progesterone. So if you don't have enough progesterone naturally, because these environmental toxins have been shown to throw off your progesterone production, you're going to experience a lot of different physical challenges, and even sometimes when you're not even feeling the effects, of the imbalance, you can still have a lot of things going on underlying that you're going to have to deal with later. So it's interesting you asked me this question right now. I try to be pretty religious with using my eternity, but we just got back from almost 6 weeks of traveling. We were all over the place. Places like Vegas, definitely not conducive to eating healthy organic options. And I had 2 days home in that 6-week journey, and I forgot the jar of cream that was full. I packed the wrong one. So I just yesterday was bedridden from it being exposed to all these chemicals and not having my cream. So definitely an extremely important, extremely easy solution to all the things that we're facing in today's society.
So, Michael, let's talk a little bit about some of these symptoms that we have noticed over the years that you have helped so many people through this issue of progesterone. What are some of the symptoms that most people are used to feeling that maybe they don't understand where it's coming from, and who also needs to be able to support the progesterone levels in their bodies?
Well, you can divide up the symptoms into 3 basic categories, Dr. Fab. If a woman is past the age of puberty, still having a monthly cycle, the first half of her month, as Emily pointed out, the estrogens should be the dominant hormone. The second half of the month, progesterone by itself should be the dominant hormone. If a woman does not make enough progesterone in the second half of her month, a woman who's still ovulating and menstruating, she will experience some combination of the symptoms of PMS. And if it gets really out of balance, the term then comes up as PMDD, polymorphic disorder syndrome. So having enough progesterone during the second half of the month, when that is brought back up to normal, the symptoms of PMS will ameliorate. The second area where progesterone is very important, progesterone gets its name from the Latin word gestare, and that for that reason it is the progestational hormone, the one hormone necessary for conception and full-term pregnancy. Interestingly, there are studies showing that women who supplement with progesterone during pregnancy have healthier children and less issues with toxemia. And then the final place where women will experience symptoms if they don't make enough progesterone is when they get older, on up into life, maybe up into menopause. They will start to experience hot flashes, night sweats, weight gain, not sleeping very well. And so progesterone, when those levels are brought back to normal for a woman in menopause, all of a sudden she's addressed the cause of those symptoms. One other thing about progesterone, Dr. Fab, that we've seen is very, very important. Bone loss in women in all industrialized countries, including the United States, begins around the age of 37 on average. What stimulates a woman's bones to build new bone tissue more effectively than anything is the hormone progesterone. It stimulates new bone rebuilding more effectively than aerobic exercise does. And by the way, aerobic exercise is excellent, but progesterone tops that by just a little bit. So women that are concerned about bone health, make sure they have plenty of minerals, that they're exercising, managing their stress, getting a good night's rest, but using their progesterone cream on a regular schedule.
So let's talk a little bit about that because, I don't like to bring just issues and concerns and problems that people have. We know that progesterone is a big challenge in healthcare. There's so many questions that people have. All the symptoms that you mentioned, what's interesting is that it seems like that's normal for most people out there because they really haven't had another solution. And of course, there's the synthetic progesterones out there that people sometimes get a little worried about because they may hear of some of the potential side effects. But now we have one that is safe. And we have one that is actually a cream, which I want to ask you a little bit about that. And this product, Eternity, which is so interesting. I have so many of my patients taking Eternity right now, and they cannot thank me enough for having their life back. I have some of my male patients and their husbands that are calling me and says, thank you for bringing my wife back to me. I know she was in there somewhere. I just didn't know what to do. So let's talk a little bit about, the impact that Eternity is having. But also, let's talk a little bit about why a cream and why a cream is more effective than some of these other alternatives that we see out there in the world.
Standard medical practice is to prescribe steroid hormones in a pill form. And the doctor knows that if he wants a net dose of 20 milligrams, he has to prescribe a dose of 200 milligrams. Now, the reason is the liver grabs 80 or 90% of that oral progesterone and turns it into a progesterone metabolite. So not only are you burning the liver when you take progesterone orally, but you're also releasing metabolites into the bloodstream that don't really need to be there. They don't really serve any purpose. So all the methods of administration topically has 40 years of safety. And I emphasize that word safety because I know that that is the number one fear factor that people have about hormone supplementation. Is it really safe? Well, progesterone in a proper cream goes back over 40 years. The Eternity formula is about 25 years old. Hundreds of thousands of women have used it and benefited. And what I said earlier, as far as we know, when women follow the directions, there are no known side effects. The safest way to normalize your primary master hormone levels is with Eternity.
And I love that because I know that today we're seeing more and more of these type of cases where doctors are baffled because, as you know, we don't get a lot of education on this particular subject in school, and it has evolved over the years. But Emily, talk to me a little bit about the fact that you have been taking the formula of Eternity for a long time. Tell me a little bit about what has been the long-term effects, and what would you say to somebody that may be listening to this call that have never been exposed to this information about progesterone, and why they should consider immediately ordering Eternity for their health and well-being?
Absolutely. So in my circle of just the friends that I know, not to mention other groups I've joined on Facebook for helping women, my journey as a female in my female health is the exception now. It's not the rule. I've never had an abnormal pap smear. I've never had a cyst. I've never had polycystic ovarian syndrome, PMDD, any kind of breast health issues. And both of my grandmothers passed away from breast cancer. So it's definitely something that I look at as preventative. I'm trying to think of what there's one other thing I wanted to highlight on. Also, I'm 33, and fertility is becoming on the rise now, and more females my age that are getting married and looking into having babies. It's taking them months and months. They're concerned if they're going to be able to have babies. As far as the fertility markers go, I check off every single marker each month with regularity and all the other things. If you want to read about them, I will go there. But I check off all the markers for fertility as well, and I don't have fear around, oh no, am I going to be able to get pregnant, stay pregnant, that I think a lot of my peers are experiencing right now. Also, I know Suzanne Summers talks about the bioidentical hormones keep her young. I am, again, proud to say I'm 33. I maybe one day will start doing things to my face. I haven't done anything, and I think that your skin health, you start radiating. Of course, ovulating regularly and having a regular cycle also keeps your skin youthful and beautiful. When you give your body the building blocks that it needs to thrive, everything thrives. Your mood, your relationships, your skin, your nails, your hair. So I definitely feel very blessed to have had this in my life. And I know my mother, she can put a man on his knees with her handshake. She's so strong, and she loves to wrestle horses, and that's her happy place, is being on a farm. And she has the bones of an 18-year-old, and she can fall on ice and she'll be a little bruised, but she's tough as nails. And that's her main reason for using the product, is to keep her youth and vitality at her age. She's in her late 60s. And she can still wrestle a stallion. So,
well, thank you, Emily. Michael, let's go back to the understanding of if I'm listening to this, what are some of the signs and symptoms that I should be looking for if I feel that maybe my progesterone level may not be in the adequate place? And then let's talk a little bit about the application of this Eternity product and what have you found in over the years of experience, all these people that have been helped by them? What do you feel are the things that we should know once we get the product in our hands?
Okay, well, as we mentioned earlier, Dr. Fab, all the symptoms of PMS can be addressed when Eternity is applied topically because you're putting back the hormone that's responsible for a woman to have a smooth menstrual cycle, no symptoms. I just want to add a little footnote about my wife. She's been using the Eternity formula for 25 years now, and when she turned, and she had her cycle 28 days every month, month after month. She turned 50 and I think 3 or 4 months, had a cycle. The next month, no cycle. She did not experience what women today or doctors today call perimenopause. Now, perimenopause is a syndrome, meaning everybody has irregular cycles all over the place. It's not a diagnosed etiology or a diagnosed cause, other than the fact when a woman is in what is called perimenopause in her mid-40s to 50 or so, her cycles might be 2 weeks apart, they might be 6 months apart. And that'll happen for several years. However, when she identifies those chemicals, puts the progesterone back into the equation, all of a sudden she goes back to having normal cycles again. Well, that's what my wife experienced. Never had perimenopause. Her menstrual cycle just stopped 1 month and that was it. And that's because she was using the Eternity formula for identifying the environmental chemicals and avoiding those to the best of our ability.
If I could add something. Oh, sorry.
Go ahead, Emily.
Just to add to that, like I had touched on at the beginning, I didn't use it this month, and I can't believe the difference that it made. I'm never going on a trip again, and like not in my normal home trying to avoid the chemicals. I'm never going to go and be exposed, and then not have that buffer because you know it's almost like having a baby. I remember maybe having some of those symptoms as a teen if I didn't use the product and I was being rebellious or something. But you forget how bad it is. And I was literally just in bed yesterday, almost in tears, and I was wanting to rip people's heads off. And, you know, thankfully I made a full, it only lasted for a day. But really, it was probably a good reminder for me about what we're doing this for and getting women out of that state and into a place where they can feel in control of their health and in control of their emotions.
So right there, Dr. Fab, is one description of a symptom that low progesterone elicits wanting to rip somebody's head off.
So what about the application? So I get the Eternity. I recognize now that I can benefit from this amazing product that has helped so many. What is the best ways that you have found to utilize this product in order to give me the best results possible?
All right. If a woman's having a monthly cycle, it should be approximately 28 days long, give or take a day or two. If her cycles are all over the place, the optimal time to start using Eternity is on the night of the day she ovulates. And there are ways to measure ovulation. Taking your temperature in the morning before you get up and writing it down is one way, but there are other ways to measure ovulation. So ovulation, one of the ovaries is supposed to release progesterone, and that should be your dominant hormone for the next 2 weeks. So that's the optimal time to use Eternity if you're a cycling female. If you have perimenopause, and this has become a real challenge for women, and I feel badly because they'll go to the doctor, they don't really get clear information except the doctor will say, well, you're in perimenopause, just go home and deal with it, and here's a tranquilizer. But what we've helped women with over the years is to use Eternity 14 days on and 14 days off until your cycle becomes normal again while you're avoiding the chemicals. Around 50 or 51 is the age for menopause for all women. That's when the last egg is released. You can no longer get pregnant. Once a woman goes through menopause and releases that last egg, she would use her Eternity any 25 or 26 consecutive days per month. It is important to observe the 5 to 6 day timeout, which is sometimes very difficult for a woman to do because all of a sudden, for the first time in 30 years, she feels good again. She doesn't want to go off the cream for 5 or 6 days. But if you don't take the time out, your progesterone receptor sites will become fatigued, and over time, they just won't work as well. So to keep your body in tune with your hormone progesterone, you have to observe that 5 to 6 day timeout if you're in menopause. Menopause, by the way, could be due to chronology, age 50 or 51, or it could be due to surgery. So those are the three recommendations. And one other thing I just add this in, Dr. Fab. If a woman wants to get pregnant, she would use it according to the cycling woman, days 14 through 28. If a woman gets pregnant, she can use her cream at least through week 18 or longer if she wishes to do so, because the progesterone is what helps her body hold on to that developing baby. You think about this for a minute. If a woman's not pregnant on day 28, progesterone drops, it causes the lining to shed. If the woman goes full term 40 weeks, progesterone levels go up to 350 to 400 milligrams a day. When it's time for the baby to be born, progesterone levels drop to zero, triggers the baby to be born. Well, what happens midterm or first trimester if progesterone levels drop? What is the signal the body reads from that? Oh, time for the baby to be born. It's only 12 weeks old, but we don't know that. Miscarriage.
Well, and it's what's sad is that we're seeing so much of that in the world, you know?
Yes. I feel badly because for a woman who wants to have a baby and can't, there are a lot of emotional issues attached to that. And for that reason, women will spend a lot of money to go to IVF clinics or wherever. If you were to Google, by the way, fertility future, Silicon Valley, a lot of effort, energy, and money is being invested in fertility for the future. And there are a lot of startup companies, a lot of money behind that. Yet, with eternity in our hands, we have the solution to address the cause of infertility.
You're holding the golden goose.
Yeah, I know. And then, you know, for over 35 years, I've dedicated my life to finding the cause of illnesses. And I realized that so many people have been conditioned to just react to the symptoms and treat an illness like if they was the enemy. But in reality, rather than observing what are the behaviors that may be causing you, and maybe looking at things from a different perspective, like what got us here in the first place? Is there something I need to do differently? Is there something I need to understand differently? And also really pay attention on how the body is designed to function, because this body of ours is probably the biggest miracle that I have seen in the world. And it's so beautifully designed to be able to maintain what we call homeostasis, which is the state of balance within your body. But we have so many stressors in the world that are really causing us to be sick, and having something like Eternity to balance the progesterone levels in your body is one of the most beautiful solutions that I have seen in over 35 years. But Michael, let's talk a little bit about Eternity for men, because the last conversation you and I had, I've been using for the last month and a half, Eternity, every single night, 5 days off, 2 days off, like you taught me. So tell me a little bit and explain to me and those men that may be listening why Eternity should be considered perhaps also for men.
Well,
I thought you looked extra smiley.
I do.
The Eternity formula, Dr. Fab, is primarily designed for women. Men who give their wives a hug every day, especially while she's using her cream, will get some Eternity and get some progesterone. Because prostate cancer is, according to the medical profession, something we all have 100% chance of getting if we live long enough, then that is a primary concern for men. What progesterone will do is interrupt that process where testosterone is converted to DHT. And DHT is what puts us at risk for prostate-specific antigens or the PSA count to go up. And while that's not an absolute test for your risk, it is a pretty good indicator. If your PSA goes over 10, you need to be pretty concerned about that. Just share this thought with you. I had my PSA tested, I think about 15 or 17 years ago. It was 2.72. 6 months ago, it tested at 1.1. Why that's significant is every other male my age in the United States, their levels are elevating. So just to repeat, Eternity is primarily for our women, but us men can be on the bandwagon too.
Well, if you listen to this call or watch this video, I want you to, I hope that this was informative. I hope that you learn more about what progesterone is and how to differentiate the two different types of progesterone. I hope that you recognize that some of these symptoms that you have developed over the years, whether you are, beginning your menstrual cycle or you are in a later stage in your life, understand that the body was not meant to be something in which it pushes you into a suffering stage. The body is just trying to tell you that there's some processes that need to be addressed. And today, I hope you understood the importance of what progesterone is all about. If you have the right progesterone amounts in the body, it makes a big difference of where exactly or how exactly you will feel. So understand that we have hundreds of thousands of women that have benefited from this product. This formula is amazing. I have seen it with my own eyes over the last few months, where so many people that I have recommended it to have had tremendous benefits. Many of their symptoms have gone away. They can't even hardly believe it because they have been experiencing that for so long. And I want you to know that the most important thing that I would suggest is for you to order Eternity and at least give yourself 3 months to be able to experience this product. I can tell you that the body will begin to function in a way that you probably would not expect, and you will start regaining the joy for your life and actually the functionality that you feel sometimes you're missing when these symptoms are present. So, Michael, anything else you would like to share, or Emily, with our audience before we say goodbye?
I do have one other thing to leave our viewers with. First of all, thank you to everyone who's watching, because obviously you're here to make a difference in the world, improve your own health. When you learn what to do for yourself, share that with other people. And I like what one person said, the secret to living is giving. So we appreciate the fact you're here. And for those who want to dig a little bit deeper, there's a resource set up, a third-party website. It's bio-progesterone.com. Be sure to click on the link in the top menu that says cycling. Scroll down and read Stephanie's experience. That is a real person who used the Eternity formula, and that is her real, actual experience with the product. That video brought a tear to my eye. It was very, very touching. So bio-progesterone.com is an excellent resource. And if you have a question, there's an Ask a Question link at the top.
Emily, anything that you feel that if somebody, perhaps this was the first time that they would learn a little bit more about the impact of progesterone, anything you would like to share?
Well, for starters, I want to just say that I'm so moved by the testimonies on the testimonial group. You guys are wonderful. Watching you have the transformations that you're having and knowing what power that's going to mean, just not only for your own life, but the people that you're going to affect and all the other lives that you're inspiring to use a product that is so simple, but we're not educated about it. And so thank you all for investing in yourself, because the better we are, the more we can move and inspire other people. And then just if you're watching this for the first time, I strongly encourage you to jump into this community. That we're creating a culture here, and it's so moving to watch this grow beyond what we've done. And you have tons of people all around you in this community who are here to help you and support you, and we're here as resources, and we have the website set up. So don't hesitate to ask questions. And thank you all for your time tonight. This is an honor and a privilege.
Well, one of the things that I get very excited in, and I want to say thank you to both of you. For those of you that are listening, I want to say that women's health is very important. It is the biggest market out there, because as we know, women make the health decisions for the family, for themselves. The word of mouth among women is the biggest there is among all, men and women. And more importantly, that this type of product like Eternity is the type of product that is transformational. It's changing people's lives from the inside out. And when somebody that you share this product with that has been struggling over the years, all of a sudden gets results, the way that we know that so many people in the testimonial page have shared so many intimate results that they're getting, I want you to know that that's what keeps us all very excited about continuing to educate and to share what we know and what we have experienced in this world. But if you find yourself being new, it's okay. The most important thing that I would tell you is become a user of the product immediately. So if you have not experienced Eternity, make sure you order it today. Don't wait until tomorrow. Order it today because it's going to make a difference in your life. For those of you that are part of Globally, bringing this product to so many of us, and you would like to be a part of this family of Globally, so you can share products like Eternity with everyone in your family and be rewarded financially, then please go to the person that invited you to this call and ask questions about how you can be part of the Globally family. I'm so excited because this is one product that I know is changing people's lives. Like I rarely see things out there in the market after 35 years of reporting on products that really make a difference. And I want you to know that Eternity, in my opinion, is a must. It's a must, and I hope that you will join us in discovering that for yourself and give yourself at least 3 months to experience it. And I know that the person that you will meet 3 months from now is going to be very happy that you did so, because I've seen it too many times with too many people, and so have Michael and Emily that have been in this world for over 25 years. So thank you, Michael. Thank you, Emily. Thank you all for tuning in. And I hope that you get excited about this product. Begin to order it right now. If you want to be part of the Globally family and be able to share this product with all the people in your life and benefit financially, please ask the person that invited you to this call and tell them, I want to join Globally. And I'm sure they'll be more than happy to show you how. Okay, God bless, and I'll see you guys on the next segment that we do. Take care.